Welcome back to FoxBusiness.com Live. Chris Cotter. Kelsey is here as well, Kelsey Hubbard. And we're talking about this Cadillac tax now. Right. It's been at the forefront of this health care legislation. And last week, it certainly became a part of the proposal that labor unions would be exempt for the next 5 years or through 2018, and government workers would be as well. Big point of contention.
Especially there was sort of behind closed doors meetings. It's been, one of the biggest sticking points in a lot of this health care reform.
It's really upset a lot of people. Mark Brenner is here, Director of Labor Notes, to talk about this. Mark, this is upsetting a lot of people out there. What was your thought when you first heard that this was indeed going to be a part of whatever that joint proposal is that comes out of the House and the Senate, that the labor unions would be exempt for a 5-year period going up to 2018?
Well, I think, from jump, this has been a tremendously disappointing process in terms of watering down, starting from such a weak place and watering it down, watering it down, watering it down. So, I think it's extremely, extremely disappointing. And then, for my mind, to see the labor unions meeting with the White House and actually saying, yeah, we're going to take the deal that is only going to buy us 5 years and, frankly, isn't going to work. I thought it was, a big mistake. I mean, I think that we definitely should have been out front on making the bill better, or at least sinking it if we couldn't.
How would you have done that? Sorry.
Me?
Yeah.
Well,
what would have made the bill better?
Well, I think first off, I would start with H.R. 676 and work backwards,
which
is a single payer measure that John Conyers tried to put on the table, and at least start debating around that. Put some teeth in the public option. I mean, they were essentially saying, public option's only going to set prices that insurance companies are already setting, and then, to go on and tax benefits instead of actually raising revenue through an income tax. It just seemed like every step of the way we were making bad choices, and labor really, thought this was the best they could do and took what they could get out of it. And I think that was a big mistake, because now, instead of being able to fight for everyone in the country and actually talk about what we all need, we're going to be standing alone, and people are going to be looking at us rightly, sort of saying, well, why do you get a deal? Why don't I?
5 years, because presumably we all start in 2013, not right now in terms of the new health care. So this is a black eye for labor, which is already fighting an uphill battle from a PR perspective, isn't it?
On health care or in general?
In general.
Well, I think absolutely this is a terrible, misstep in terms of actually appealing to the broad public, and it won't work. I mean, let's back up here. They're trying to raise $150 billion, 30 of which is actually going to come from people switching to cheaper insurance plans, and then the rest is supposed to be because employers are going to pass on those savings to workers, and they're going to pay higher income taxes. That's never going to happen. I mean, if you sat at a bargaining table and watched employers look at cost savings like this, they don't give that back. And, our negotiating position at the bargaining table hasn't been that strong in recent months. So I think the plan's destined to fail. It was a bad deal. It was a big mistake.
And the supporters of the Cadillac tax said it's essential to tamp down medical spending and that over 10 years it would generate more than $200 billion. Critics say the tax would quickly spiral out of control and hit middle-class workers, people more closely associated with, as this says, minivans rather than the Cadillacs. And you're saying it won't work, it'll hit middle-class workers. So you think that the critics are right here? And why is this? I mean, why is there such a big discrepancy? And as you said, from the beginning, this was a wrong, the whole health care reform should have started off at a different point. But is it politically viable? I mean, was that an option?
Well, I think it's up to, our legislators to make it an option, and I think this is where the labor movement really made a mistake. They took their cues from Washington instead of taking their cues from the rest of the country. We need something better than what's on the table now, and I think we could have actually been out there changing the calculus in Washington had we not been, taking our cues from Capitol Hill and from the White House.
Labor supported President Obama in his campaign.
Absolutely.
And in the election, obviously. Do they feel like, in your mind, and it's collective here, that they have a man in the White House that backs them and supports them, and that's why they support him in this role as well, because they feel like over the next 4, 3, maybe 7 years, they need to work together with the president?
Right. Well, obviously, I'm not invited to any of these kind of meetings, so I'm far from these kind of decisions. But I think that what people are most worried about is that this is going to be Obama's NAFTA moment, that people are going to feel betrayed. They're not going to turn out the polls. This is going to have a backlash at the midterm elections. And I think rightly so, because we have seen time and time again where this administration could stand up for working people, could actually stand with people on Main Street and not people on Wall Street. They haven't done that. And I think people are really wondering, what did we vote for? Where's the change that we supposedly voted for?
Do you think rank and file is more along your way of thinking than the labor leaders who obviously negotiated this deal along with the White House?
I think so, and I think that I'm worried that they are thinking along the ways that I am thinking here. And I think that, unfortunately, you know, the folks who are at the heads of most of the major labor unions are spending too much time talking to people in the Senate and people in the White House and not enough time talking to their own members, or they would have probably taken a different tack.
Or maybe do you think they just thought, you know, it buys them some time for down the road, who knows where this country will be, where politics will be, who will be in charge, and they just, at least for the time being, struck a deal because it was politically, you know, resourceful for them to do that at the time, and they're just looking that perhaps it will change down the road.
Right, that's a good point, Kelsey, because as you were saying, this is not even going to start till 2013, and so, you know, 5 years after that is when this is supposed to kick in. Lots of things can change between now and then, and that may very well be why this sort of calculus was made. I think it's a mistake because I think we're really missing a chance to speak for all working people here as a labor movement, which is really what we do when we're at our best. And I think that it's going to come back and bite us in the ass.
Will this cause more companies that are maybe on the fence to become union shops, because now they see, if this does indeed pass, because then all of a sudden they see, I'm going to have to bear the additional costs, whereas so many, you know, the union shop down the street doesn't have to. If I don't go union, I'm going to have to go union.
I think this definitely keeps the same calculus in place in terms of whether it's cost neutral for employers in terms of benefits to go union. It definitely, you know, keeps private insurers in place, and we're going to bargain as hard as we can for better benefits than what people are getting. So I don't think so. I think we really missed a chance to actually take that out of the equation with a Conyers-style single-payer legislation. I mean, look, that's why auto companies are moving to Canada and open up plants there when they're closing down plants here, because it's $1,200 a car. Cost advantage to produce in Canada, where they have a national health care system. You know, it's inexplicable to me why this wasn't part of the discussion here in this country.
Well, Mark, I know there is a growing negative connotation when it comes to people and unions around the country right now, and I wish your voice would, they'd listen to you a little bit more, because that's exactly why people feel that way. Unions are forcing manufacturing outside of our borders, and I think, you know, you have some good things to say about that that might change some people's minds. Thanks, Mark. Good to see you.
Absolutely. Good to be here.
Mark Brenner, Director of Labor Notes, getting us up to date on what's going on with this Cadillac.